recording?
Game plan. We would game plan in the truck, but we can't. We don't have a truck right now.
There you go, okay. No rush, patience, just, not having trouble
You guys just
breathing.
went through the door, you didn't knock on the side, stand to the side of the door.
All right, you arrive on scene, you find 54-year-old
You know
male.
that's true.
He is seated on the porch in this presentation right now. Visibly, you see that he appears to be having labored respirations.
Is he tripoding, or is this just the way
He
he's
is
sitting?
tripoding.
Okay. Sir, hey, how you doing? My name is Mon. What's your name?
His answers are very short, gaspy answers. He says, can't breathe, I'm normally on oxygen, can't breathe.
Okay,
What is his
remind me on
respiratory
that.
rate?
His respiratory rate is 22 to 24.
What about pulse?
Pulse is 128. It is rapid but regular.
And what's his blood pressure?
Well, I don't know. You haven't had enough time to take a blood pressure yet.
Oh, I thought you were finished. You wanted me to lock up. What?
No, sir. So we are done. Everybody's got everything out of 1104, correct?
Yes,
Correct.
sir.
Okay. Yes, sir. We're finished in 1104.
How much longer you be here?
We're going to be here until about 3:30.
Okay. All right.
Yes, sir.
So,
We had police on scene for a moment. Seems so.
all right. That's from that. All right, so what were you doing before this actually happened?
Okay, so if we've got somebody, and we're gonna break a little bit, just kind of intervene stuff as we go. If we've got somebody that's struggling and having gasping answers, we want to try to limit some of our questions. It's best if we can make things yes, no, things like
Close-ended
that.
questions?
Right, because we don't want them to have to put a whole lot of effort into that if they're already struggling. So we can ask things like, do you have a history of a breathing problem?
Well,
You know,
he's on
that,
oxygen,
he
yeah.
can nod, he can say yes, you can say, if he's on oxygen, that's kind of, he's already clued us into that.
Go ahead and squeeze my hand. Are you on any medication, any medical needs besides the oxygen you take?
He states that he has lung cancer and emphysema.
That's rough. I shouldn't have said that. Okay, sir, have you
What's his
eaten?
blood pressure?
Have you taken anything in?
Blood pressure is 180 over 96. Now,
That's high.
this man was already, when you arrived on scene, he's already in a tripoding position. He's already having gasping respirations. We do want to pursue our full medical, but we
He's
might
a-
want to consider an early
go.
application of
Yeah.
oxygen,
Go
just to
ahead.
at least go ahead and start treating the
So I would set him
symptoms.
up with a nasal cannula, or I'm assuming this is what kind of oxygen tank do you use? Do you use the over the ear?
So normally
or
he's
you use
on
the mask?
2 liters Homo 2,
Crazy.
but he currently does not have any oxygen.
He doesn't have any oxygen.
So
we'll
we
set
would
him up
start
with
him at 2 liters on a nasal cannula.
Okay, that's at least getting something on him.
Mhm.
And what we can do is, if you've got a partner, utilize your partner. So what you can do is, while one of you is obtaining vitals, while you're trying to get some information, have your partner do everything, all right? So at this point, I want to really put a focus on the process as far as the actual evaluation of oxygen application. So talk me through what you're doing as far as the tank.
So,
Tell me the entire
With
process.
the tank, the first thing we'll do is crack it.
Okay.
To make sure the air.
I don't have a thing to actually crack it with, so.
Yeah.
Oh, cool. Glitter. Alright, wait. I have no idea where it is.
I'm on, yeah, show them how it works.
I looked at that and I just
So
said,
you can
"Nope,
do it
that's
with the
magic."
whole unit closed up?
Yeah, you don't need to bring
So-
that,
Oh, okay.
With this, what's awesome about these right here is you grab it just like that and stick it
Okay.
over the top. If you've got a multi-tool, you can do that. There's a wrench there. But yeah, talk me through the process of
Alright,
the
crack.
checkoff for oxygen.
Yeah, the first thing we
Okay.
I
crack.
cracked it
And why do we crack it open? And
So-
we,
to clear out anything that could have gotten in there.
but
Alright.
we
make
don't
sure-
leave it open though. We
No,
pop
I
it open
already-
real quick, just
yeah,
to
crack and
purge
put-
and close it. Okay?
Alright, I'm putting on my
Attach the
regulator, making
Okay.
sure the holes line up.
All right.
I'm tightening it up now. Alright. Crank it all the way. Alright, that's tight as it goes.
Mm-hmm.
Let's see, got it.
And I know that in a call, we would already have this assembled and put together, and I know we
Yeah.
would be putting an emphasis on patient treatment, but we're just trying to take a pause
Here's
from
your
that and focus on the actual, this process to make sure we're comfortable with
Set
this.
it to 2,
Then,
Oh,
yep,
kiss
here, after you put the regulator on, you turn it on, and you'll set
and then
it
I'm
to
gonna
your leader
look for the
minute.
Okay.
nasal cannula isn't in here, it's in the other bag.
While we put that regulator on, and
Lay this down.
Wait, why is the
Did
nasal
we-
canyon not in the O2
did we crack?
I don't see, I have the,
Second.
So
this
after we
one-
had the regulator on, we opened the valve all the way open,
Mhm.
and what are we looking at on there?
For
It's- I
any,
set it to 2.
leaks,
yeah, I didn't hear
Sure
any
it's
leaks
tight.
or anything.
Okay, so we don't hear any leaks, and additionally, we're looking at that gauge and we're reading what the pressure within our
Yeah.
bottle is.
Yeah,
But
there's-
yeah, we're listening for any audible sounds of leaks.
and 2,000 is the, preferred PSI.
So that's where we start at.
Yep.
Keep it. That's the BVU.
Well, so go ahead,
Why
just,
is it, why is the nasal cannula not in
use a non-rebreather just because that's what's on the actual skill evaluation, so talk me through that process.
Alright,
So,
sir, if you're
we
okay
would
with me, just nod your
Put the
head.
non-breather on.
I'm gonna
it.
put this
Put our
non-rebreather on
thumb.
you.
No,
After
before we
I
put it on, we'll fill it
There
up
we
with air.
go.
Mhm.
Yeah.
We never wanna put it on the patient deflated,
Yeah, we fill it up with air
Put
first.
this on,
alright?
go ahead,
So we put it
cover
on,
this up, let it inflate.
alright, and what would we be setting our regulator to?
Right, it's already set to
15.
2.
What? It
I don't know,
depends.
yeah,
So
we're
for
using the
non-rebreather,
NRB.
For full non-breather, 15.
Okay.
Partial, say 10 to 12.
Right, some regulators have a 12 setting, some
one's a
only
partial.
are 10 and 15.
Mhm.
That's,
Or
that's the
partial
only
is 10
range.
then.
Alright, so I'm gonna go with 10 at the lowest,
Okay,
just because he has emphysema and I don't wanna blow him out while at the same time it's a partial.
okay,
So I'm holding this down, filling it up.
alright, bag is full now.
Yeah. And we'll
Okay.
place it on.
So we're gonna go ahead and put this on. Are you okay with that? What do you say?
He gladly accepts it, he's grabbing it and pulling it onto his face for you.
There you go. Cool, appreciate that. Thanks for
So
helping
the
me,
other
dog.
thing we can do, rather than tying that, so if we grab
Yeah.
these, we can just pull these forward. Now, this is a very small person, but
Okay.
these things will pull forward out, and that cinches down so that it holds it tight.
Okay.
Alright, we pull that on both sides?
Yeah.
There you go. Alright, so lined up.
So now he's on oxygen. After
Okay,
this
so
point-
now we'll go back to, as far as our medical assessment, we'll go ahead and pick right back up where you left off. So, to recap, you had just gotten your vitals, you had
What about a
asked for your
CRT?
blood
'Cause I
pressure, it
checked
was
it.
180 over 96. Capillary refill time is within 1 second.
Okay,
So
that's
it's,
good. Alright, so his heart rate's fast just because his breathing is labored, not
Correct.
because he actually has a heart problem.
Correct.
Good information. Oh, no. Okay. Alright, sir. Let's see, so we got,
Yeah, symptom allergies.
yes. Do you have any allergies? What are you feeling right now? How are you feeling? Do you have any pain? Just squeeze my hand if you got pain.
So,
What do you say?
he states that the oxygen is helping a little bit.
Okay, that's good.
He has no medication allergies that he's aware of.
Okay.
He has his medications that he takes, but he doesn't remember the name of them. He's got a bag full inside.
Okay. When was the last time you took that medication? Do you remember? Like, show me some fingers.
He took, and he'll be able to communicate some. It's just, like I said, we try and have like real short, simple answers. Yes, no, do you have breathing trouble? Okay, are you allergic to anything? No, okay. And we can go through things like that.
You can say like, have you took meds in the last 12 hours? Yes or no? something
Well,
like
and
that.
generally we'll
What's the
ask
range?
for the relative so, if somebody has asthma and uses an inhaler, I'm gonna ask, have you used it today? How many times? How long ago?
Right.
If we're doing something chest pain, I'm gonna really focus on, have you taken an aspirin? Do you take nitro? Things like that. We're gonna ask, if their blood pressure's high and they tell us they take blood pressure medications, have you had it today? Do you normally take it in the morning? So we can really focus on the medicines that are right now, just anything that is pertinent to the patient care. And we can get a lot more detailed later on. But for right now, we're just gonna focus on things that are pertinent to the presentation and the care for him at this moment.
Okay. So I asked him if he's for his medication. I asked if he took anything. What
He takes his regular daily medications.
Okay.
He doesn't remember the names of them, but he's got a bag and he's already got it sitting here ready to go with him. So
Alright.
we can tally those up.
Honestly, I would have already loaded and going
Okay.
because he's
Yeah.
he's other than the lung cancer, he's struggling to breathe with emphysema, and that's what I'm feeling. And I already asked if he had any pain. You said no. You said the
Good,
breathing
so
was good.
that's one of the things, so as we moved through our medical assessment, we went through, we started, we did his airway, we moved through breathing, you started assessing circulation, and then you rapidly identified, is this patient, this is somebody that is gonna be a load and go, we need to rapidly transport them, and we can continue things en route. Okay, so, for the purposes of that, we'll say that at this point, we are en route. Now, since he's seating, we'll say his
Yeah, we're
position of
sitting in-
comfort
yeah,
is
full-
sitting up, just
yeah,
because he
full
doesn't
valve.
like laying
Yeah.
back. All right, so let's go ahead and continue on our assessment then.
All right, so we're in the truck. We
Mhm.
got him hooked up to the monitor. What am I reading now? Since it's been, I don't know how long has it been.
Well-
I say he's a.
So at this point in time, your secondary blood pressure, it has slightly reduced. It is now 162/88. His heart rate is slowed to 118.
So
Respirations are still around 20 times per minute. His O2 sat has increased to 93%.
All right, so he's slowly getting better.
Mhm.
All right, that's good.
And he looks visibly in less distress.
All right, good. So that means we don't really need to change anything for him.
Okay?
All right, we already know he doesn't have any pain, so OPQRST is out. We already did sample. Is his speaking?
So-
How is
So-
his speaking
And
able
so
a little better?
OPQRST doesn't have to just be relative to pain, it can be relative to whatever we have. So just like if we asked them what you were doing when the pain onset, if it was chest pain, we can ask him what he was doing when his difficulty breathing onset. So we can still look into it. Now, we don't have to ask all the questions because obviously there's certain things that aren't gonna be relative in every situation.
Yeah.
But we can still find out, was he exerting himself? Did he go out on the front porch to smoke a cigarette? Things
Shame.
like that. So,
Dang,
but
Bernie.
this one, in this instance, he just states that he's been out of his oxygen for a while. It's been getting worse over the last couple of days, and now he just really
Alright,
felt in
so-
distress.
Okay.
So will we do a
So-
secondary assessment?
Yeah, go
now from
Okay.
head to toe?
All right. So, and we did that initial. You had your very focused during your primary, so we can do that secondary assessment. All right.
Yeah.
So, what system are we focused on for this secondary assessment?
So,
So
head,
check
we'll
it,
start at the
yeah.
head. First thing we're checking is the brain. So
Mhm.
the eyes
I already
are
did
the
that.
direct pathway to the brain.
Yeah. So
Okay.
how
So
is
check that
so
out.
what is his?
Pupils are equal, round, and reactive to light.
All right, they're not like weirdly small or anything.
Nope.
All right, cool. All right.
Airway is
next.
good. He's talking.
Yeah.
Yep.
Yeah, he was
Airway-
talking to us
airway is
before, so
patent.
we know it was
He's
at least
talking.
clear.
And
Uh-huh.
And
we check for breath.
jugular vein distension, yeah or nay?
None noted.
Okay,
Okay.
cool.
Then
Next.
we'll move down.
Chest.
Chest. Check for
The first up, yeah, sounds and rise. And
Okay. So, what are we looking for when we're looking for the
equal chest
physical?
rise.
All right. We're looking for good
Bilateral.
equal chest rise,
Yeah.
And not
we want
seesawing or
bilateral.
anything like that.
All right. So you have good equal chest rise, you have bilateral breath sounds. They do sound somewhat shallow. You notice that he's not taking full deep breaths,
Okay.
but
But that could
Lung
be
sound.
that would be more towards the emphysema and the fact that he's lung cancer than anything else. Yeah.
Then we would, after that, we would move down
Palpate
to the
stomach.
abdomen,
Yeah.
the abdomen, and
Okay.
palpate the abdomen, make sure it's not in.
abdomen is soft, non-distended, no tenderness noted.
Okay. Since he's sitting up, would I ask him if how his back is feeling? Since I can't check it since he's up against the thing.
So when we're focused on a trauma assessment, we more so have to go through all of that. As we go through a medical assessment, we put more of an emphasis on just the body systems that are involved. We don't have to do, we still want a full assessment of him, but we're not going through, we're not looking for back problems, we're not palpating the spine, we're not doing all those sorts of things. That, we're
So did I
reserving
palpate
that.
around the kidneys or anything like that when I palpated the abdomen?
You can,
I just
yeah.
wanted to know.
Yeah, you can do that. You can, you can just ask him generally if he's having any other complaints, because he may have this and something else going on.
Okay.
This just may be the primary
How's
symptom.
your
But again, even though it's a secondary assessment, with medical patients, we really just want to kind of put a big emphasis into whatever that organ system that's going to be infected, whether it's cardio, pulmonary, whether it's GI. That's where our focus is. It's not so much having to do the entire body. Because obviously we're not concerned about his gout right now.
dude? You got gout
But,
and cancer?
but that would be something good to know in our full detailed report
When we get
of
to
all
the
of his
nurse.
other medical history and everything else.
Mhm.
All right?
All right. So he's sitting. Yeah. You peeing? You pooping? What's up?
And making sure it's
His all
You able to
bowel
get it up?
activity has been normal. He's urinating regularly.
How's it going with the ladies or men? No judgment.
It's just not so great, you know. The whole being tethered to an oxygen line.
Hey,
Right,
man.
So
I've seen them nursing home
how
people get around.
frequently are we reassessing this patient?
Q15.
Yeah, and I'm doing it.
I mean
every
Q5.
five.
I'm sorry, no Q5.
Every
Okay.
five
Q5.
Why?
because well we found him tripoding.
Okay.
Yes, he's getting better, but
So
still,
he's improving, but
yeah.
this was still an emergent. Anytime we decide a patient is significant enough that we had to do a load and go,
Exactly.
then this is somebody that we want to be reevaluating every 5 minutes. All right? Anything else you want to do for this gentleman in row?
Go ahead
Check
and
the
check
lower extremities.
Yeah, I'm gonna check.
Okay.
Definitely check the pulse on his on the back of his knees, and I'm checking limbs as well, just because I want to make sure there was no shunting. I mean, we already know there isn't, just because the CRT was
And
good.
make sure his motor
Yeah.
sensors.
Make sure he can
pulse
feel,
motor sensor,
yeah,
mhm.
feel
Okay.
everything, and then we'll check his feet.
And everything
Yeah.
else checks out great.
Cool.
All right, so let's back up. We can kind of go, let's talk our way through. So when you came in, because this was a simulated scenario, you actually came in with your equipment, everything is assumed. But remember, when we're going through for registry, we need to verbalize these things. And that's why it's so helpful to memorize this sheet, is we still need to make these statements. It's really helpful for you just to read these off. So when we walked in, real world, obviously you only see there's one patient. Even when you run the scenario, you're gonna see there's one patient.
But still
But
ask.
for the purposes of registry, memorize all these individual lines. That way, you're knowing, okay, BSI, my scene is saved, you know, how many patients, this is my only patient. And the thing is you could have even, with recognizing the severity of him, you could have asked for ALS. Of course, I'd have told you that ALS was
Yeah.
unavailable, but, you know, it's still something you can still consider that option. But the big thing is try to make sure that we're hitting each one of these checkpoints. And real world is always gonna be easier than scenarios, because you have to ask me, what is he breathing like? What does his skin look like? All of these things, where otherwise, you're gonna see these things naturally.
Yeah, I didn't ask just because I was
Right.
you know,
And so,
preoccupied. I should have.
and so that's what we do. So just put a little focus on to working on that. All right,
That's why I make
so
sure-
as far as for y'all that were documenting,
Mhm.
so let's see what y'all thought was important out of this that we would need to document for a PCR.
Well, we already knew, like for this one, we already knew the number of patients from the call.
Yeah,
we
but
already
we
knew
still
what
gotta add.
mechanism.
And that's what I
and
said,
nature,
so
yeah.
with these, if we're running it as a scenario, then you're already gonna be well aware of this
What is she-
information. You were dispatched, you know what you're going to, you know the number of patients. But just kind of keep in mind that when it comes to, for just this evaluation, make sure that we hit those. But yeah, again, this was self-explanatory, real world, it'll be self-explanatory. All right, so for your call, what did y'all do? What did you think was important to know? Let's start out with the important information.
Well, from what I got from him, he said that he didn't have allergies, and his past medical history was lung cancer and emphysema, and normally at home he's on 2 liters of oxygen, and he currently has none.
Okay.
And his medications are unknown and in a little baggie that I think he had provided, and
Mhm.
his last oral intake was his daily medicine, which we don't know.
He didn't tell us when he
Yeah.
last took it, when he took it either.
Yeah.
Right. And again, we could really push for things if it was more involved, but if we're just talking about somebody that takes his cancer medications, things like that, once we're actually, because this is a load and go, we can defer a lot of that to that secondary evaluation in the truck where we've got that more time to transport and go through those.
Yeah, the chief complaint was difficulty breathing, so.
Okay, so
Where's the nasal cannula?
when we look
Must
at
be
doing
like
the
taken out.
PCR, what is the main things that we need? What is the purpose of a PCR? Other than for it to be a legal document, what are we trying to get out of that PCR?
It
Actually
helps with
giving
further-
all the information that you
It
need
helps
for
with
this.
further cases, like
Okay.
further. I can't think of the word, but
There's no
Studying.
continuity of patient care, being able to pass that information along. Okay, so what things we're looking for is we need to be able to paint an accurate picture of, this is what we went to, this is what we found, this is what we did, this is the end result. So we're kind of going through that. What I always tell people is when it comes to the documentation of your narrative, now, everything's going digital now, so there's a preset format, but if we're writing something out, me personally, I still use paragraph narrative. My department allows us to use whatever we choose, so I just still use a paragraph because that's what I've done for 15 years. What I tell people is be familiar with SOAP, be familiar with HR, be familiar with the narrative. Most places, they have a preference that they prefer, that employer has a preference, but the biggest thing when it comes to your report, your vitals, especially your radio report, don't necessarily do what I do, don't do what he does, don't do what anybody else does. Do something that you can do consistently, that you can repeat. What that means is when I write my vitals, my blood pressure goes here, my heart rate, I write my vitals in a specific way. My age, my chief complaint goes here, my allergies go here. I always write it in the exact same way. When I would do my PCR, when it was narrative, when I would write everything out, I had a set order I would go. When I call in my radio report, I have a set thing that I repeat. And the reason that we do that is because 90% of the calls that we go to are going to be very simple, straightforward, and a lot of this is unnecessary stuff. But if you do it over and over and over, you're going to be very consistent with it. So what that means is when you get that actual critical emergency, you're not the guy calling in going, all right, so he's shot, you're fumbling through. You're going to say, because you've done it so many times, you're going to say, we're en route to your facility with a 28-year-old male patient. He's suffering from a single gunshot wound to the left arm. Hemorrhaging is controlled at this time with the use of a tourniquet. Vital signs are as follows. This is my BP, heart rate, respiratory rate, O2 sat. You're going to hit those benchmarks because you've done it over and over and over again. So that's the consistency is the huge thing that comes with it. And so as far as for your documentation, the things you're writing down, if you're hitting that same flow, whatever format it is, whatever, I don't know if there's a particular one that y'all are doing for the class. Okay, then, all right.
Yeah,
So
I like soap.
if you have a choice, then pick what's good. If you have something for the class, learn it, but be familiar with the others. But be consistent with what you put. If you go for that same approach of every single time saying, I'm going to put down the information, I found this. This is what I found. He was he's a 54-year-old male, and I'm going to say how I found him. Arrived to find 54-year-old male in respiratory distress, presented in tripod position with audible respiratory distress. Then I'm going to say his past history. Then I'm going to say, okay, this is what I did for him, and if it made a difference. I'm going to talk about his past medical history of COPD, emphysema, he has lung cancer. I'm going to say patient requires home O2 but was out. Then I'm going to say my treatment, what I did for him. I placed patient on a non-rebreather at 15 liters, and I'm going to state, did it make it better? Was there an improvement? Patient verbally stated improvement. So, that way, it's what I found, what I did it work? Now, if it's a radio report, I end with, I'm this far out from the hospital. I give them that ETA. My documentation, of course, I'll document transport to the hospital, position of comfort, whatever little, all the little stuff that goes with it.
I got a question.
Yes.
Are we allowed to record this, like audio record, like our notes, or does it have to be written down? Like, I know when we write the PCR, we actually have to write the PCR. I'm saying like.
I don't think you can
when
keep
we're-
the recording.
So it gets into.
No, I'm saying like,
Yeah,
I'm saying like I can say this person has is X.
If you're, if
Like
you,
I'd say 54-year-old
can you-
male, blah 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 blah.
Right,
blah,
can
blah,
you
blah,
legally
and-
document that stuff? You can. The thing is though is, you're really not, like, a lot of people they'll put a piece of tape on the leg, they'll write things, they'll write vitals, some people write it on the sheet. A
I'm just
lot
worried
of
about
it,
losing it.
yeah, a lot of it, is just your personal preference. It's what works for you. The thing with HIPAA is you can't keep documentation or something that provides a patient name or disseminate information to anyone who is not directly involved with patient care.
Well,
That being said, if all you're doing is if you have some way of making notes, there's no difference in me writing a handwritten note of
Yeah.
his information
Yeah, I'm
and
not
getting
putting
rid
his
of it.
name, it's just straight.
Right. And if that works for you, then that works.
I'm about to get it recorded.
I mean, it's just the monitors that we have in the trucks actually have quick shortcuts. If you're running a code, you can hit a button to make an index mark, and it'll print it out later. The computers have got
The life pack?
the life packs, the Zols, they both have that option. The tablets that are utilizing ImageTrend, which is now the state standard, that uses an option where you can index.
I was kind of curious about those. If they had,
But a lot of
like,
what's
I know that these are done electronically, especially with the
Mm-hmm.
reports now and like tough books and things. If I'm sitting there with the pad, do these programs allow it to where I'm dealing with a cardiac situation? Would it have a list of pertinent negatives to go through on there, or is that still
No.
you got to remember?
no, that's still going to be something relative to you.
It's a lot.
Yeah. It really, it becomes, I know it sounds like a lot right now, but you get really familiar with it. You're gonna get to a point where when you guys get dispatched, you're immediately, the way it's gonna work is you're gonna form a list of possibilities in your head and you're gonna be checking them off. You're gonna get dispatched to the one down on the corner of such and such, and in your head, you're going, okay, this is either a diabetic, or this is a drunk, or this is somebody who's had a stroke. And so you make that list, you're laying that out, which one's the more severe one. We're going stroke, diabetic, drunk, and then as we get there, we start ruling things out or confirming. So I'm adding a check mark. Okay, he presents this way, he's diaphoretic, he's this, I'm adding things, but I'm ruling things out, and we narrow it down. So it seems like a lot to memorize, okay, these are all the pertinent negatives, these are this, but you're going to be steadily narrowing in on what you've got, and it's just going to become second nature. You're going to do it without even thinking about it. You're going to get dispatched. You're going to reach a point that when you guys start your radio report, you're going to think through it, you're going to write it out, you're going to practice it and say it to yourself, then you're going to call it in, and you're still going to stumble a little. You're going to find yourself that at some point at 2:30 in the morning, you realize you're about to pull up at the hospital and didn't call, and you're going to, from the cuff, pick up and just spit off your entire report because you've done it so many times in sequence that you know what to do and you don't have to work through it. All right, so who's going to be our next crew up? Joseph?
Yeah, I'm down.
All right, so pick a partner.
I'm sorry.
I gotta get you a new show. I'm sorry.
There we go.
Don't close it, don't close it.
Got him. I like it.
Alright, sweetheart, don't have to.
Yeah, I got the 10.
All the stuff is on the table for you. No, this is my chair.
You didn't find the nasal cannula?
Yeah.
No, we did not find a nasal cannula.
Well, let's look in another bag then and see what we can come up with. Meanwhile, I'll get this all over here. All right. I don't want to take the other classes, but
I think someone took it from ours.
No, someone did take it from ours.
Yeah.
Here, check this out.
Oh,
Here, just get another. Do we have
the AEMT was using up the.
Well, there's 3 bags over there, so maybe we just grabbed the wrong bag. Yeah, we grabbed the wrong bag.
You think
Is
so?
there another one on this one? Cause there's
Here.
right
This
here.
is how we set
This
it.
This is ours.
Let's fix the problem and let's put a nasal cannula in the bag and make it complete.
Yeah, no, this one's ours because it has that ugly green hose.
That's fine. So we've got that in there, but we'll throw one in just so their bag's complete.
Sir, the ugly green bag, the weird Ziploc, this is ours.
All right, so who's the next crew going in? All right, so for the ones
I'm
that
gonna
are
type
not
my
going
PCR
in,
on.
when you do your PCRs for this one, and I got paper if you need it, but try and mimic the format that something that, and so go ahead and the things we're looking for, we're gonna wanna know the age, the sex of this patient, we're gonna wanna know, how they presented, and then we're gonna try and see what is pertinent out of what goes on that we think needs to be written down.
Alright. So subjective, that'll be what the patient says.
Yeah,
And
that's
then,
good.
objective is what we find.
Oh yeah, see,
Pretty
it's ours.
negative.
Look at the number on the side.
Alright, so the other thing is, we're gonna have, when you write your PCR, based on what you have, I'm gonna have one of y'all give me a transfer of patient care, as if you were either calling into the hospital or giving a report to the hospital. We're gonna go do something in that.
Where'd the dummy go?
Go through the process of, I wanna see what you dealt with in
Yeah,
blood.
no.
Alright. So, you two are on a double basic truck right now. Yes, you would not be responding to, I know there's certain things that y'all would normally not respond to as a double basic, but because it would be outside of your scope, and it's understood that you would call for ALS, but I'm going to go ahead and tell you now that ALS is not going to, ALS is not going to, they're not going to be available. You're always going to be told, oh, they're 10 minutes out.
Which sweet old person is making cookies right now? They just want to spend some time with people.
Oh my god. No, that's from a show called Sirens. There's a lady who they like love, and she makes the greatest cookies of all times. So like all the time, basically like they compete, they listen for the address, and then they call for it. Those are the rules. First come, first serve.
There are people that will call just to toss and be conversational.
Is that
All right. So, you're going to be responding to complaints. This was a third party that called in and said that there's a male who is seated in the front yard, leaned against a tree. They don't know what's wrong with him. Somebody they saw him sitting on the ground, leaning against the tree, and they said he looked like
No, I'm not writing a piece.
Alright, what is it called?
And they're planning this week on EMT students. We watch an EMT student in his natural habitat.
Alright. Okay, we're gonna come in, we're checking if our scene is safe.
All right, so the scene is safe. As you approach, what you see is you walk into this is a very large yard. You see a push mower, you see what appears to be a half-cut front yard. You see various yard implements. It is warm outside, it's middle of the day. You see this gentleman who is conscious, alert, and oriented. He does look at you and acknowledge you approaching up, but he appears pale and he appears diaphoretic. He's sweating heavily and pale in his color, but he is alert and looking at you. All right?
How did we
He
say
says,
this dude
"Hi,
was?
I didn't call y'all, but I'm
How
glad
did
you're
we say
here."
this dude was?
Okay, so
Yeah.
Okay, so he is verbally communicating with you, so yes, we can assume his airway's paid this time. His head just won't stay up.
Okay, yeah, that's concerning.
Okay. Yeah, it just doesn't stay up.
Sir, can you tell us what's going on with you today?
So he says he was working out here in the yard and he just got feeling really faint and fatigued. He says his chest was hurting him and he said maybe he's overdone it, but he thinks that's all it is he's overexerted himself a little bit.
Alright. I'm gonna ask permission for the patient if I can do a quick assessment. Patient says.
Yes.
Okay.
Are you allergic to anything?
No, he's not allergic to any medicines that he knows of.
and we're gonna have to cut this.